sacrum. Please read all of them. If you have any question, I am ready. Today I'm present here. I can answer to your question. It is the heart. If you imagine, this is the diaphragm. The heart rests on one surface that we call the diaphragmatic surface on the superior surface of the diaphragm. The apex is directed anteriorly, downward, and forward. And the base is posteriorly in the right side. Here is anterior surface, left surface, right surface, and the diaphragmatic or inferior surface. The sulcus coronari is a circular sulcus that around the heart is going to divide both atrium through the both ventricle. The anterior interventricular groove or sulcus is visible here. Inside of the anterior interventricular groove or sulcus, I am able to show you the vein and the artery. It is going to find in the anterior surface of the heart. And here's the apex. If you notice, the anterior interventricular groove is going to be continue to posterior interventricular groove. In which surface of the heart the posterior interventricular groove is visible? Inferiorly or diaphragmatic surface. The apex is here, and here is the posterior interventricular groove and anterior interventricular groove. The right atrium, right ventricle. Left atrium, left ventricle. In the right atrium, if I want to explain for you, I can remove the anterior wall of the heart. Here, I am able to show you anterior wall of the right atrium, the pectinate muscle. The crista terminalis is visible here. Now, yesterday, I explained for you the sulcus terminalis. Sulcus terminalis is a longitudinal groove here.
Right.
Exactly inside of the heart here, I will be able to show you the crista terminalis. It is crista terminalis. Crista terminalis is going to divide the anterior wall with the pectinate muscle through the posterior surface with the smooth muscle. Because the heart is in our thorax sleep, oblique, so here is the interatrial septum, and this is the fossa ovalis. Fossa ovalis. If you notice, here is fossa ovalis. Please pick up each of you the heart and find the fossa ovalis. The vena cava superior without wall, the vena cava inferior opening is here with a rudimentary wall. And here is another foramen, this foramen. This foramen belongs to coronary sinus. This foramen belongs to coronary sinus. And a valve here also is visible. So, fossa ovalis, foramen that belong to the sinus coronary, foramen that belong to vena cava inferior, vena cava superior, and the right atrioventricular orifice. What's the name of this valve? Tricuspid. Consists of three cusps. Here is the right ventricle, because the pressure of the blood inside of the left ventricle is high, so the interventricular septum is going inside of the right ventricle, okay? It curves inside of the right ventricle, toward to the right ventricle. The anterior part of the interventricular septum is muscular, and the superior or posterior part is fibrous. I told you one of them, the fibrous part, is here between the left and right ventricle, and one of them is between the right atrium and the left ventricle. Here is the left ventricle and the bicuspid or mitral valve. Inside of the each of the ventricle, we have three kinds of the muscle. One of them we call the papillary muscle. Some of them, in some of them, the papillary muscle is better. Give me this or this one. This is going to show you the papillary muscle, and the chorda tendino are going to connect the valve, the cusp of the tricuspid to papillary muscle apex. Here also we have papillary muscle. and this chorda tendino are going to connect the apex of the papillary muscle to cusp of the mitral or bicuspid valve. Here is the inflow and here is the outflow. Outflow of the right ventricle we call infundibulum. At the apex of the outflow here, we can find the opening that belongs to the pulmonary trunk. And here you have a valve with three semilunar cusps that we call the pulmonary valve. We call the pulmonary valve. The pulmonary trunk come up and divide to two branches, the left and right pulmonary artery. Please tell to me which of them is longer, the left pulmonary artery or the right pulmonary artery? It was one of the questions. The right pulmonary artery is going toward to the right line. When it is going toward to the right line, it is passing posterior to the ascending aorta and the pulmonary and the vena cava superior. It is passing posterior to vena cava superior and posterior to the ascending aorta. It is possible in your exam, I ask you, it is the superior vena cava. What's the name of this vein? You know? Yes. It is the azygos vein. Azygos vein. It is going to drain to vena cava superior. Now look at to the left atrium. Left atrium, most part of the left atrium is smooth. If I have the anterior wall, it is not for this. If I have the anterior wall, it is the right auricle and it is the left auricle. The left auricle is longer and narrower than the right auricle. And you should know that if I rotate, here I am able to show you the left atrium. The opening of the left and the right pulmonary vein are visible here. Left and right pulmonary vein are going to go inside of the left atrium. Between the left atrium, left ventricle, inside of the sulcus coronary, in inferior surface, it is the inferior surface, not anteriorly. If I rotate between the left atrium, left ventricle, inside of the sulcus coronary, I am able to show you a dilated vein that we call the sinus coronary. The sinus coronary is going to accumulate all of the vein, all of the blood vein that belong to the heart and take to the right atrium. Now, the sinus coronary, it is the posterior interventricular sulcus. Which vein is visible here? Middle cardiac vein. If I rotate inside of the anterior interventricular group, which vein is visible here? Greater cardiac. Greater cardiac anteriorly, middle cardiac posteriorly. Where is the lesser cardiac vein? The lesser cardiac vein is coming here between the right atrium and right ventricle. Inside of the right side of the sulcus coronary, it is going to reach and drain to the sinus coronary. The sinus coronary is going to open inside of the right atrium, and I show you the opening of this sinus coronary. It is the opening of the sinus coronary. Opening of sinus coronary. What's the name of this?
This is the ovulus.
Fossa ovalis. Fossa ovalis. What is this? Opening of the sinus coronary. And what's the name of this valve?
Tricuspid valve.
The outflow of the right ventricle we call infundibulum or conus arteriosus. The outflow of the left ventricle we can call vestibule of aorta or aortic vestibule. So outflow of the left ventricle we call aortic vestibule. Outflow of the right ventricle we call infundibulum. It is inflow, it is outflow, means the blood from the right atrium go into the right ventricle and here go to the pulmonary trunk and here go to the ascending aorta. Now about the what was the I think.
That's one.
No, perhaps this. Now here we have the right coronary artery, and here we have the left coronary artery. The right coronary artery has the right conal branch, has some branch for the anterior wall of the right atrium, for the right ventricle, right atrium. It is the marginal branch, and the right coronary is going posteriorly. It is going to be continued inside of the posterior interventricular groove, and here make the posterior interventricular branch. If you want to guess that this heart is left dominant or right dominant, this heart is
Right.
right dominant, because here is continue of the right coronary artery. Now the left coronary artery, as the first, it is passing posterior to pulmonary front, and very soon divide to two branches, anterior interventricular and circumflex. The anterior interventricular is visible inside, has the left conal branch, has diagonal branch, and at the end it is very long. It is going to be continue posterior surface and make anastomose with the posterior interventricular artery. What about the circumflex? Circumflex has left marginal branch and it is very short. It is possible sometimes you find the circumflex longer than normal. For example, here you have the anterior interventricular and here is the circumflex, and here is the left marginal branch. Again, this heart is right dominant. As I explained for you, most of the time the heart is right dominant. And I think explain everything for you. If you have any question about the